All right. Hello, everyone. My name is Dr. Chelsea. I serve as the program manager for Gateway to the Rockies Opioid Council, Region 10, also known as GROC. And today we are doing a webinar on program evaluation. I do have a couple of updates. First, there are going to be listening tours over the next 2 weeks in each of the 3 counties that Region 10 is comprised of. So the Jefferson County listening tour will be on March 20th from 10 a.m. to 11 a.m. in the Fay Griffin Conference Room at the Jefferson County Courts and Admins building. Gilpin County will be the same day, Thursday, March 20th, from 2 to 4 p.m. in the big room of the Gilpin County Library. And then Clear Creek County will be Thursday, March 27th, from 12 p.m. to 1 p.m. in the Clear Creek County Health and Wellness Center. There is an RSVP link for each one of them just because we are providing food. The RSVP is not mandatory, it's just highly encouraged. These events are open to the public, highly encouraged for the public to attend. You'll get a chance to meet me, learn about the National Opioid Settlement, specifically the Regional 10 Council and our work, and then have an opportunity to share out your concerns about addiction and recovery in your community. That conversation will help shape the RFA review process happening April through June for the current RFA that's open. I also wanted to take a moment to differentiate between the letter of support and letter of acknowledgement, keeping in mind that these are entirely optional. There is no numerical value assigned to them. The letter of support should only be used for partners or collaborators of a service outlined in the application. It should not be used by someone your organization has previously worked with, expressing that they have a great relationship with you and you would be great to carry out this work. We are being very intentional with these letters of support to limit overwhelming the review committee. The letter of acknowledgement is entirely neutral language. It should not have any verbiage like strongly support or much needed work in the community. It really is just intended to demonstrate interest from the community of the proposed service area. So for example, if you were a large staffing agency in the state of New York and you were proposing a co-responder program in Gilpin County, Clear Creek County, and Jefferson County, you would want to have a letter of acknowledgement from literally anybody. It does not need to be an elected official. From each of those counties saying that they've spoken with you, they are aware your application is coming forward, and they're interested in learning more about your application. It's to ensure that projects really are community-based, not community-placed. And I do give you definitions for the difference in the funding announcement, so please go look at that. Also, final reminder, keep in mind that projects should not be progressive, novel, or innovative at this time. The council is really looking for safe, empirically tested, evidence-based programs that have a history of being successful. So another way to think of this is stay in your lane. If you have been doing recovery housing very successfully for 10 years, and all of a sudden you want to start up a treatment center, I would advise against that application. I would first advise you to submit an application to fund your recovery housing project, build a relationship with the council, let them get familiar with you, your work, your patrons, submitting reports, and then next year consider submitting that expansion program into treatment. If you have a partnership with someone who's doing treatment and you're just looking for funds to pay for that would also be a good application. Please feel free to jump on my calendar if you have more questions about leveraging the letter of support or letter of acknowledgement. They will not be included in the first round of funding or the first round of review. They will only be brought up if your application makes it to group discussion. Again, the LOS is really just to ensure that you have your ducks in a row for a project that you are proposing, ensuring a timely implementation, focused on partners or collaborators, third-party vendors that you talk about in your application. All right, so jumping into what is program evaluation. Program evaluation is a systematic process to assess the effectiveness and efficacy of your program, your policy, your project, your service. It does involve collecting and analyzing data to answer questions and make recommendations. Its purpose is to provide feedback to program managers such as myself or the council, inform policymakers and planners, identify areas of improvement, and ensure the programs are functioning as intended. So you should have at this point some objectives for your overall project that you identified early in the application. These objectives should also be linked to tab 2 of the budget template, where it says goal 1, goal 2, goal 3, and then you identified some steps on achieving each one of those goals. So these goals will lay the foundation of your evaluation plan. This is where you tell us what type of data you are going to collect to make sure that you are achieving this goal in the timeline that you laid out later or further down in that budget template. This could be as simple as counting the number of participants who participate in your program, counting the number of naloxones or Narcans distributed, how many harm reduction bags are distributed, how many people attend a training. You might also have a satisfaction survey of what did people like about the training, what didn't they like about the training, what was their biggest takeaway from the training, and then having some type of follow-up measure 30 days later. Oh no. I saw someone say me neither. Hi, everyone. I was talking to myself for 8 minutes. I thought I started the webcast and I did not. Can everyone hear me now? I absolutely love WebEx. All right, let me try this again. Linda, you might need to switch the audio. Okay. Let's try this again, friends. So my name is Dr. Chelsea. I serve as the program manager for Gateway to the Rockies Opioid Council, Region 10, also referred to as the GROC. A couple of updates. We do have listening tours planned for March. Jefferson County listening tour will be Thursday, March 20th from 10 a.m. to 11 a.m. in the Faye Griffin Conference Room of the Jefferson County Courts and Admin Building. Gilpin County will also be on Thursday, March 20th from 2 p.m. to 4 p.m. in the big room of the Gilpin County Library. And then Clear Creek will be on Thursday, March 27th from 12 p.m. to 1 p.m. in the Clear Creek County Health and Wellness Center. There is an Evite with an RSVP link just because we will be providing food. It's not required, it's just strongly encouraged. These listening tours are intended for the public to attend. You'll get a chance to meet me, learn about the national opioid settlement, specifically the Region 10 Council and our work. And then there'll be a guided discussion for people to share out their concerns on addiction and recovery in their communities. These discussions will guide the RFA review process scheduled for April through June. I also wanted to take a moment to differentiate between the letter of support and letter of acknowledgement, because I've been getting a lot of requests about letters of support and they are not being used correctly. The council is not using letters of support as a generic someone that you have previously worked with who says you're great to work with and you would do well at the project you propose in your application. That is not how we're using this. The letter of support is intended to be a letter of collaboration or partnership. So if you, for example, are partnering with a prison to provide some type of recovery programming, you're going to want a letter of support from that prison that states they've agreed to partner with you in the way they describe, the way you describe in your application. It's a way for the council to ensure that all of your ducks are in a row with community partners that you identify to ensure a timely implementation of your project, program, or service. The letter of acknowledgement has extremely neutral language. It does not have verbiage like strongly agree, their critical work. It's really just intended to demonstrate that someone has reached out to someone in that community and they've told them about this project and the community is interested in learning more. So for example, if you were a New York staffing agency and you were proposing a co-responder program in Jefferson, Gilpin, and Clear Creek counties, you would want a letter of acknowledgement from literally anybody in one of those 3 counties saying that they've spoken to you about this application and your project. They're interested in hearing more through the RFA review process. It's to ensure that projects are community-based, not community-placed. If you're looking for a more descriptive definition between community-based and community-placed, please reference the glossary in the funding announcement. Finally, just a reminder is that projects should not be progressive, novel, or innovative at this time. The council is really looking to fund empirically tested, evidence-based, safe programs and services that demonstrate success. So no risk taking at this time. Keeping in mind that the council is very much in its infancy. It's only its 2nd round of funding. It's only its 3rd year of existence. So they're not looking to take chances on things. So if you are asking to fund a model and you don't have any evidence that that model is successful, that is risk taking. So try to narrow down your budget to something more practical, to the aspects of the model that have proven success. Keeping in mind minor risk is always good. All right, so today's webinar is all about evaluation, really the final component of the application. So program evaluation is a systematic process to assess the effectiveness and efficacy of a program, policy, project, service. It does involve collecting and analyzing data to answer questions and make recommendations. The purpose is to provide feedback to program managers like myself or the Region 10 Council, inform policymakers and planners, identify areas for improvement or persistent gaps, and then ensure programs are functioning as intended. Amy, I'll get back to your question at the end of this. So in the early part of your application, you had to identify the primary objectives of your project, service, program that you were implementing. That informed your work plan template. So this is the 2nd tab from the budget template that we provide you. So the first one is your category, like your line item budget. That is a snapshot of the total budget you're asking for, not individual meticulous lines. trying to clump things together in categories. Then you had to do the work plan where you carried over from your objectives 3 goals, and then you identified steps to meet that goal. All of this is going to inform the evaluation plan. Notice that this is an upload. There is no template because there are a million ways that you can write your evaluation plan. You should identify the specific data that you will use to assess your program or service project. There is a glossary of performance indicators in the funding announcement. There is also a note there that says this is not all inclusive. It is a guide. The performance indicators that you pick should match these goals and this objective. So if we'll go through some examples. You might choose to adjust the information in a table like this, and I just did this in Word. And then in addition to the table, you would have a narrative. So this would be your objective or your goal from the budget template. I would include all of them. Where are you going to get the data? So would that be like attendance sheets? Do you have a digital check-in? Are you using EMS patient charts? How frequently is the data collected? So is that like once a month, every call that's made? Who is the responsible staff member? And then how are you going to analyze it? And this could be as simple as counting, summarizing. You can just copy this right here. So when I talk about a narrative, you don't have to do paragraphs. You could use 1 through 8 and just put an answer to each one of these at the end. Your data collection software, it might be Excel. I use Monday.com forms and Airtable forms quite frequently. I collect data every time I have an event. The organizational process you will implement to ensure the accurate and timely collection and input of data. So is this that 10 minutes after every call, clinicians will do note-taking or charting in the Excel spreadsheet. Staff will be responsible for collecting. You could literally just list names. And if you don't have a name, because that's a position that you're hiring, you could just put their job title. Data sources and data collection instruments. So if by chance you are measuring recovery capital, you should put recovery capital, best at all, and which year you're using. How will the data collection methods, how well the data collection methods will take into consideration the language, norms, and values of the populations of focus. And so has the survey ever been tested on this specific population? For example, Dr. Best's measure of recovery capital. This is the gold standard of measuring recovery capital nationwide. It is extremely empirically tested. It has never been tested on college students. It's always been tested in clinical settings on adults, mostly adult white males. So that would be a limitation that if I was measuring recovery capital of students in a collegiate recovery program, I would want to mention that limitation here. They just understand addiction differently than adults. Females understand addiction. People with disabilities understand addiction very differently than white, able-bodied, middle-class males. So identify that here. Do you have, if you're doing a co-responder program and you are collecting just patient demographic information in the call, and the patient is primarily Spanish speaking, do one of your co-responders speak Spanish? So that would be something that you want to address here, multiple languages, identity type. Process and policies that will keep data secure. So is your software HIPAA compliant? Excel and Google is not HIPAA compliant, so you would want to address how you're keeping that safe. If applicable, the data collection procedures to ensure that confidentiality is protected and that informed consent is obtained. So again, that people know that you're collecting any level of data on them. If you're not collecting identifiable data like name, address, phone number, email, Consent could be ongoing when they register with your program. So it might just be like, again, demographic information of the people that you contacted in Q1. So you're going to say like 50 males, 75 females, 25% of whom were below the poverty line. And then you would have maybe like 10% white, 15% Latin, Hispanic, X. If you have sexual identity information that you can provide, none of this information is make or break. It should meet the capacity of your program to collect that information. All right, so option one, you can design your own system of evaluation using the REL Program Evaluation Toolkit. I do link the toolkit for you right here. This is one of my favorite things to use. I'm going to switch screens. So it looks like this Program Evaluation Toolkit. It gives you a little summary of where it comes from, but then it gives you a series of models. So module 1 through, I believe there's actually 8 modules, and there's little worksheets. There's like 15-20-minute videos that walk through every part of building a good program evaluation. So you can skim through this. There's transcripts, there's PowerPoints, there's YouTube videos that you can watch in 2 times speed. But it walks you through every part of a program evaluation. This is extremely advanced. So again, this is not required. This is just an additional tool to help and support you in your program evaluation. So I do direct your attention specifically to module 2, the evaluation question, and module 5, data quality. Again, this should all connect back to those goals from your budget template that would connect to your evaluation questions and the objectives of your project. If you are newer to evaluation, a descriptive evaluation is completely fine. Option 2, an introduction to tracking, assessing, and evaluating using listing and counting. So I give you a Excel spreadsheet. This is a total example. My SMART goal, or like my goal 1 from that budget template, was to launch the No Shame Pledge presentation on campus in fall. So step 1 is I would complete the Train the Trainer with Rana by August 10th. I would schedule 2 student Train the Trainers with 10 students each, or 20 students total, by August 31st. I would schedule the No Shame with 2 student trainers in the College of Social Work by, put the date. I would review those satisfaction surveys between December 12th and 15th. I would make any type of presentation adjustments and retain the student trainers. And then I would repeat these steps in spring of 25. So I'm measuring success by the number of student trainers I have, the number of events I hosted, and the number of students I engaged using my Excel spreadsheet. That's how I'm going to track them. I will know success when I have 4 student trainers by August 31st. That is an abstract goal that I made up. I will host 2 events before December 15th. Again, an abstract goal that I came up with. And then I will engage a total of 30 students by December 13th. And all of this is how I'm achieving and I'm measuring the success of launching the No Shame Pledge presentation on campus in fall of 24. So then I have just a table of all of my events, and I'm counting the number of participants I had at each event. And then here's my evaluation reflection. So I had 22 student trainers. I way exceeded my goal. I only hosted 1 event but I had 67 total students. So I would say that I was like still really successful. And you can see I did this by September 9th. My original goal was August. That's still okay. Then I give you a little narrative. Generally, the fall 2024 goals were accomplished. We exceeded the number of student trainers and the number of total students engaged. We only hosted one event. We will adjust our spring 25 goals to host 2 events, retain the 22 student trainers we have, and find another way to engage them since we only need 2 trainers per event. We will aim for a 10% increase in engagement. So that'd be an increase of 7 students. So I would hit 75 total students engaged by the end of the spring semester. This is a great quarterly report. This is a great mini quarterly evaluation that would be submitted. I'm going to take a break before I go into some examples, and let me see if I can get back to the chat. So Amy did ask if I anticipated everyone should have a multiple letters of acknowledgement or letters of support. No, absolutely not. I don't anticipate everyone would have that. That's why it's completely optional and there's no numerical value assigned to them. All right, jumping into some examples. So I'm revisiting my objectives and my SMART goals from tab 2 of the budget template. And one of those is serve 1,000 individuals annually through direct recovery support programs. So I'm going to pick the data that I already have and that I can easily get, like counting. So I'm specifically going to be looking at intake forms, attendance records, and participant surveys. I'm going to track the number of individuals enrolled in recovery support programs, including their demographic information and the types of service that they received. So again, that would be like a really simple Excel spreadsheet. Monday.com or Airtable do something really similar to that. Just ensuring that whatever you use is HIPAA compliant if you're collecting personal information, identifying information like that. So if you just use like Excel and Google Drive, Airtable, or Monday.com, you might assign people some pseudonyms or patient numbers that you keep in a password, the key in a password protected document. Utilize intake and discharge system to document participant engagement. I would establish monthly and quarterly benchmarks, like 250 participants per quarter, to ensure progress towards my annual goal. Ensure data collection aligns with the program objectives by tracking improvements and participants' well-being. So I'd be using self-reported recovery capital measure, housing stability reports, or employment reports. And that can all be done qualitatively through like just like clinical interviews. It doesn't have to necessarily be a very impersonal kind of survey form. And then conduct monthly evaluations to assess progress, identify gaps with a comprehensive year-end review for final evaluation. In example 2, so same thing, I revisited my big project objectives early in the application, and then my SMART goals from tab 2 of the budget template, and I had identified reduce opioid-related overdoses in the community by 10%. So I'm going to use data from EMS reports, public health records, and law enforcement data. I already have access to those through my job. So I'm just leveraging what I'm already using. And I would track opioid overdose rates through local health department data, the EMS report, the hospital records by simply counting. Maybe I do this every week, so it's not like overwhelming. I would establish monthly and quarterly benchmarks. So like in quarter 1, I'm really just looking for implementation, baseline, and process. But in quarter 2, I'm looking for 2% reduction in overdose rates. Quarter 3, I'm also looking for a 2% reduction in overdose rates. Again, you can make this a number, a percentage. It has to be relevant to you and what you're already doing. I would implement targeted interventions such as naloxone distribution, public awareness campaigns, peer support initiatives, and then it's time bound because I'm conducting quarterly reviews of overdose data to assess trends and identify high-risk areas for additional outreach. If you would like additional examples of evaluation, you can and should visit our website and go to the 2024 grantees page and look at the Q1 summary report. And this will show you specifically the current grantees, kind of what their goals were and how they were achieving them. So what their progress, what goals were met, what goals were not met. This is a high-level summary from their reports. This is not their exact report, but it will help give you some ideas of what they should be looking like, what you should be putting in your evaluation. All right, so again, evaluation is not a one-size-fits-all model. Today's webinar is intended to be an informational guide only. Generally, your evaluation plan should align with your objective and goals from the budget template, report on the effectiveness and efficacy of your program or service. So be descriptive. You do have the option of contracting a external evaluation team. And so that is a permittable use in your budget template. It's aligned with Exhibit E. So you would want a letter, specifically a letter of support from whoever you contract to do your external evaluation and design your evaluation plan. Most external evaluation firms will do a free consultation with you and they will draft out a brief evaluation plan for the application. And then their letter of support would say, we agree to contract with the applicant for X number of dollars to perform the evaluation as described in their application. And then once you go through, if you are awarded from the GROC, you go through contracting with them, they would have a much more descriptive evaluation that you can submit as an amendment to your contract with the GROC. So again, this one is like, it doesn't need to be super, super detailed. It can be high level. We will have learning forums to have capacity building and evaluation on your specific projects if you are awarded. You can also review the March Council meeting practice sheet for additional examples of evaluation plans and some feedback on those. So a large portion of the March 25th council meeting is going to be educating the review committee on how to read applications and how to score them. So there's a not so great, a decent, and a really good application that you can review. And then I give feedback notes on the whole application for you to consider and think about to make a stronger application. So this is available to you, again, as a tool. And that is today's webinar. So I will wait a few minutes to see if there's any questions in the chat from the community. If you do have a question, I just ask you to put like typing. That way I know I'm waiting for something. Amy, where is this application located? Which application? Like the one that you submit? The program evaluation toolkit? It's linked in the slide deck. So the sample, the practice sheet for the review committee and the council that we'll be using at the March 24th meeting is linked in the slide deck. And I did drop the slide deck at the beginning of the chat. If you don't have it, it will be in the body of the YouTube video when I post this webinar, so you'll be able to access that. I did just put the slide deck link back in the chat, and like I said, it will be linked in the YouTube video, in the description of the video when this webinar gets posted, which should be later today, first thing tomorrow. All right, next week we do have our webinar, which is final reviews of applications and submitting into Civic Plus. So basically I will just be going over this rubric very extensively with you, and making sure that you understand what's an upload, what's a text box, what those text limitations are, in Civic Plus. On March 25th, the webinar will be specifically for current grantees submitting a renewal application. So I'm really only expecting 4 people to come to that. And then the final we have an office hour this Thursday from 1 to 2. Remember, that's a drop-in meeting. And then there's a final office hour will be on March 20th. I did cancel office hours on March 27th just due to the historically low attendance. And I have back-to-back listening tours in different counties on the 27th. We have that council meeting on March 24th. I do recommend everyone attend that because I'll be going over very extensively how to review applications, how to use the rubric, and then the application window closes on March 31st. Please make sure that you jump on my bookings calendar sooner rather than later to do a 30-minute final review of your application for completeness. Because once those spots it's filled up, I'm not opening them up anymore. And then, yes, we will have reviews starting in April. If you have any questions, feel free to shoot me an email, reach out. I'm here to support you through this brand new process. I know it's a little overwhelming. I've tried very hard to make it straight to the point, A, B, black, white. Yeah. Thanks, everyone. Have a great day.